Dr. Rachael Coleman. I'm so glad that you joined us today. And today we're talking about weight management, the science, health, and practical solutions to what? Transform your life. Okay? So why do we care? You know, why does weight management matter? You know, over 70% of U.S. adults are overweight or obese. Overweight or obese, 70%. And why this matters is because the excess weight increases the risk for chronic disease. But guess what? Small changes, just some small, consistent changes can make a huge difference. So how do we define overweight or obesity? So we define being overweight as having a body mass index, or BMI, between 25 and 29.9. 25 and 29.9. Obesity is when the BMI is over 30. Morbid obesity is if the body mass index, or BMI, is over 40, or if it's over 35 with comorbidities like diabetes and heart disease and so forth. So you can also calculate your BMI. There's a weight calculator. The calculator, you can take your weight and multiply by 703 and divide it by your height in inches squared. Or you can just go to Google and put in body BMI calculator, and it will calculate it for you. But it's on your chart. When you go to your doctor's office, nowadays, with the vitals, we calculate your body mass index. And this is a prompt for conversation, okay? So now, what we consider a healthy weight may be a little different than what Grandma told you, okay? Because Grandma was trying to put some meat on your bones, right? You know, and quite frankly, some of us like being a little thick. Can I say that? Can I be real? Okay? But when we look at health risk, it is a health risk. Did I mention that being overweight or obese, morbidly obese, is a health risk? It's a health risk. And how many of you want to live long and strong? Right? And without some of the things that come with being overweight or obese. So, we ask a question. Are you overweight or obese? Don't say it out loud. Don't say it out loud. You don't have to. You don't have to. You know. And then, but if we were to have a conversation, how did it happen? Was it after a surgery? Was it a change of the job? Was it lifelong? How did you become overweight or obese? Was it stress? So much stress in life? Well, I can tell you, I mentioned earlier that I left a very big hospital system. And months later, I found myself in the overweight category. Okay. But interestingly, I went to visit some family in another state. One of my aunts said, "Rachel, you gained some weight, didn't you?" I said, "Yes, ma'am." I hung my head down because I was feeling it too. And she said, "Looks good." What do you do with that? She felt like, I was looking better, looking more prosperous, and quite frankly, some of us connect being overweight and obese with being prosperous. Some of our parents and grandparents went through hard times, and they wanted you to have that extra padding just in case times got hard. But how many of us have actually encountered those hard times? There's plenty of pantries. And if you know how to shop, you're not going, you're not lacking. Do I dare ask how many of us ate out this past week? Who ate out this week? You ate out. Somebody paid. Was it you? So you got some coins for that, huh? Okay. All right. So what's your own story? When did it happen? Was it a pregnancy? Just keep that in mind, okay? All right, so there are many health conditions that are linked to this excess weight, okay? Type 2 diabetes. This is when your blood sugar is elevated beyond a certain point. Heart disease, a whole list of heart diseases and strokes that can happen. Heart disease including high blood pressure. Okay, if your blood pressure is consistently above 140 over 90, that's high blood pressure. You need to get it down. Sleep apnea. When a person gains weight, their neck gets bigger. Okay, this is a problem for some of the CDL drivers. They can't get their medical certificates because they're gaining that weight, and the risk of having sleep apnea. And with sleep apnea, you stop breathing in the night. Your brain wakes you up to take a breath, so you don't get the deeper stages of sleep. It's not restorative. Excuse me. And some people have what's called narcolepsy, where they fall asleep during the day. And what do they do behind that? They have that cup of coffee loaded with sugar, reinforcing the problem. Okay, so we don't want to have sleep apnea. If you have sleep apnea, please wear your CPAP. Okay. All right, that's going to help your heart, reduce certain strains. And then there's certain cancers that have been proven to be associated with the excess weight. Osteoarthritis, that just means arthritis, so if you got arthritis in your hip, your knee, pain in your back, your lower back, arthritis is worsened by weight, all that weight. And some of, the orthopedic surgeons have a protocol. If you're above a certain body mass index, you have to lose a certain amount of weight even to have your knee replacement. Okay? You don't need to look to your left or to the right because somebody may incubate and try to lose some weight for that surgery. And then finally, fatty liver disease. We don't usually talk about this, but this is major. That excess fat has to have somewhere to go. And when it starts to infiltrate the liver, it can be problematic because your liver is trying to detox your body. Okay? So we don't want fatty infiltration of the liver because, it's been a few years, but anyway. And none of my transitions show up. But anyway, I don't know what happened. But okay, so this is again the 70%. Okay? And then these are our definitions. Okay? Just to keep in mind that what the BMI is and what defines overweight, obesity, and morbid obesity. Okay? Y'all remember, how did it happen? Complacency, okay. All right. Well, we can change that, right?
Yes, ma'am.
And then these are all those conditions that are linked to that excess weight, from type 2 diabetes, heart disease, strokes, apnea, certain cancers, osteoarthritis, fatty liver disease. All right, so metabolic syndrome. Okay, so if you don't have a definable condition like the diagnosed with high blood pressure, or you're diagnosed with diabetes or heart failure, there's something that's called metabolic syndrome that's going to put you at risk for certain things. Okay, metabolic syndrome is a group of risk factors that increase your risk for heart disease, stroke, and diabetes. So even though you went to your doctor, you got so-called clean bill of health, but you didn't have high blood pressure, you didn't have this, that, and the other, they said we'll see you next year. But if your waist circumference is above a certain point, your blood pressure is above a certain level, your cholesterol and glucose are above a certain point, 3 or more of these factors together can cause metabolic syndrome, and it could be a signal that you are on your way for some of those conditions, okay? All right, so keep that in mind. So if, you don't carry certain diagnoses, but your waist circumference, you're pre-diabetic, your blood pressure is, the systolic number is above 135, the vital number is above 85. Those can be a signal that, the caution light is flashing, okay? And so how can we change this? All right, and then as we get older, it's a blessing to get older. We want to age gracefully, but there's something called sarcopenia. And this is a type of muscle atrophy that's common for getting older as we age, okay? So some people after their 30s or after their 40s, they will see a decline in their muscle. And the causes are aging, inactivity, poor protein intake, some hormonal changes. So your muscles play a huge role. So your muscles are metabolically active tissue. So it's very important to keep your muscles engage. And how do you want to do that? You want to do a little strength training. That means lifting a little weight. You know, shopping at Walmart doesn't qualify, okay? You're really, being intentional about lifting the weights and doing some reps and so forth. And eating protein. If you're vegetarian, you don't have to eat meat, but you can eat some beans. Find something else that has protein content, and you want to get up and move, okay? All right. There are some key hormones that are important that regulate weight. This is not an all-inclusive list. This is just some of the hormones, okay? Commonly, when a person's having challenges with weight, doc, I need you to check my thyroid. It's got to be my thyroid. Well, thyroid hormones is just one type of hormone. But there's insulin. Insulin, when we eat, a certain amount of insulin gets released into our bloodstream to help that sugar get into the cell. But guess what? Insulin will promote fat storage. So the more you eat, the more sugar you eat. Just think of that being pushed into your fat cells, okay? Leptin. Leptin, this is the hormone that tells us that we are full. Are you full? Y'all just, hey, y'all full? You feel like, I need a little something sweet right now. This tells you that you are full. The fat cells send a message, I'll come back to that, but there is something called leptin resistance. And this leptin resistance can be responsible for overeating. Next, there's a hormone called ghrelin. Ghrelin is produced in the stomach. It causes growling. It causes that you know that you're hungry. It's the hunger hormone, okay? So some of y'all feel that hunger at night, okay? We'll come back to that. And then there's cortisol. This is a main player. We think of fight or flight. It's our stress hormone. Okay, my cortisol level is a little high right now, but but cortisol, it helps us to function, but sometimes we can get stuck in a stress mode, okay? And then, of course, the thyroid hormone that helps to regulate metabolism. Your thyroid can be over or underactive. All right. Are you stressed? We'll pause for a reflection right there. Are you stressed? Are your cortisol levels high? And cortisol levels can confer weight gain, especially in the belly and the back. Okay? So if you want to get rid of some belly and back fat, is bring down those cortisol levels. This is why it's very important to have a healthy go-to. Have some hobbies that you enjoy. It's not work all the time, okay? Take a break. Bring those cortisol levels down, right? Know when to go to bed and get some sleep. Okay? All right, so I think you pretty much know to eat right, okay? There are some diet problems and there are some solutions, okay? Some of the problems with the food that we eat and that are problematic and that cause weight gain are the processed foods. Too much sugar, too much eating out, and snacking. When you snack a lot, you're going to have an increase in your insulin levels. You're going to get a spike in your insulin, and it's going to cause fat storage, okay? You might want to stop snacking. Okay, solutions. You want to eat whole foods. Have plenty of protein and fiber. Drink plenty of water. And be mindful how and when you're eating. So here comes questions. Do you eat a lot of fast food or processed food, baked food? Do you snack often? Do you eat without being hungry? Just because, it's supposedly time to eat. If you're not hungry, maybe you shouldn't eat, especially if you're trying to burn off some fat storage, okay? And then you have to be consider what you're actually eating. All right, so there are some recommendations for fitness and exercise. So, just because you walk around Kroger's getting your groceries, that doesn't mean that counts as fitness. Now, for some who are deconditioned and maybe they're dealing with a physical ailment or a medical condition, that may be for them because they may need to go home and take a nap afterward. But for most, that doesn't count. You need to get, for moderate exercise, it's recommended to get 150 minutes per week. 150 minutes per week. That's like 30 minutes 5 times a week. or if you have vigorous exercise for 75 minutes, okay? This is the exercise and fitness recommendation. And this recommendation is more so if you're trying to maintain your weight. If you're trying to lose, you need to kick it up, okay? A little bit longer, okay? Now, exercise and fitness will only, if you have a lot that you need to lose, it's going to help you lose about 5 to 10% of your body weight, okay? About 5 to 10%. I want you to keep in mind that you can't work off of that diet, okay? You need to really eat, we need to eat better and eat food that's going to be very nourishing to ourselves, okay? So, it's recommended to do strength training at least twice a week, and consider walking, okay? Going for a nice walk and help your heart health, lower your blood sugar, boost your metabolism, and reduce some stress. If your cortisol is level high, it may be time to go for that evening stroll. Today's a nice day, after we finish the event, okay? All right. So here's the question. It's the question you ask yourself. Do you lack a consistent personal fitness routine? Are you giving the gym a donation every month? It's just a donation because you're not showing up. And if you lack one, think about what you can do, okay? All right, sleep is very important. When we think about weight control, who would have thought that sleep would be a significant factor, but it is. Poor sleep will cause higher ghrelin levels. Remember, ghrelin is the hormone that causes us to feel hunger, okay? And leptin causes us to know that we are full. So if you have higher ghrelin levels and lower leptin levels, that can in and of itself cause a weight gain. And then also, poor sleep causes elevations of your cortisol level, and you get more belly fat. Y'all like that belly fat? Okay, well, and the studies have shown that sleeping at least 7.5 hours a night, or whenever you sleep, because I know there's some shareovers, but 7.5 hours, at least 7.5 hours. The study participants who consistently got 7.5 hours had less problems with their weight. Okay, so are you getting less sleep than 7.5 hours per night? Anybody? Okay. All right. How can we change this? All right. So everybody, wants to say, well, everybody not feeling this big bone, we're just a big bone, because our genetics, and genetics does play a role. Yes, ma'am. Yes, sir. Genetics does play a vital role, and when there are several genes that are connected to weight. But it's a combination of things, okay? So your genes can affect your metabolism, of course, your hunger, fat storage, but your lifestyle plays a huge role, okay? So genetics, the saying goes together, but lifestyle pulls the trigger. So, you guys, it's a combination of things, okay? And then another thing is some behavioral things. So family always gets together, every time we get together, we got to eat big. Right. But at your house, you outdo the other one, and we've got, all this excess food, so consider how we can change it. How can the family get together and encourage each other to eat healthier and better? The gut microbiome, okay, we've got good and bad bacteria, okay? There's some good bacteria that lines the gut and the bad bacteria, okay? The gut bacteria can affect calories and metabolism, all right? So there's certain bacteria that are healthy. I'm not even going to try it. So y'all see the names of the healthy bacteria, and then the unhealthy bacteria. Guess what? The healthy bacteria like the healthy foods, okay? They like the whole foods, some greens and some tomatoes and this, that, and the other, different whole foods that nature made. And the unhealthy bacteria that are responsible for weight gain, they like pizza, fries. I know know, you make the best lasagna, but, you know, and macaroni and cheese, is that a food? Is it a real food? I mean, it's processed in a lot of cases, so keep that in mind. And then, because of what we eat, you know, the prebiotics is the type of foods that we eat that are a healthy environment for the healthy bacteria to grow. Okay, so two people can eat the same thing. The one that's colonized with good bacteria will pull out less calories. The one colonized with the bad bacteria will end up pulling out more calories from the food. Okay, all right. So we're going to ask the question: is your gut unhealthy? How can we change this? Huh? How can we change this? All right, so then there's, well, I think what time it is, but I'm almost done, you all. I appreciate your patience. Insulin resistance. Okay, this is when the cells don't respond to insulin and creates a hyperinsulinemia. And insulin resistance, especially in Black and brown communities, sometimes you can kind of tell if a person is insulin resistant because there's a condition called acanthosis nigricans, where there may be that dark appearance to the neck, dark appearance to like sides of the face, dark appearance, you know, to the armpits, and you can't wash it off. So, you know, if you have a child that, you know, or a teenager, you think, oh, well, you know, they need to wash their neck because it's that dark patch on their neck. It's not dirt, okay? It's a condition, it's an evidence of insulin resistance. And so the problems is that with insulin resistance, that can lead to prediabetes and fat storage and the metabolic syndrome that we talked about earlier. Causes all those refined carbs, all that processed food, inactivity, just sitting around playing video games all day, eating pizza, and not sleeping, okay? Solutions, you see a theme here: weight loss, exercise, whole foods, sleep, and stress reduction. So again, this is just another slide that talks about insulin resistance. It's a condition where the body cells don't properly respond to insulin. The pancreas produces more insulin to try to compensate. And so, why is it a problem? It keeps your blood sugar elevated. It's like a lock and a key, because that glucose can't go into the cell like it needs to provide energy to the cell. So it causes a lot of problems. Okay. All right. Then there's that what's called leptin resistance. Remember, leptin is the hormone that tells you you're full. Okay. So when you have leptin resistance, your brain ignores the signal telling you that you're full. Okay. The problem is you got constant hunger. You're eating all the time. You got slow metabolism. Okay. It's not just your thyroid. It could be leptin resistance. So what's the solution? Whole foods. Yes, ma'am, yes, sir. Whole foods. Exercise, sleep, stress management, and a modest loss of weight. Again, this is just a schematic telling you that, you know, the fat cells is full trying to send a signal to the brain, but the brain's not getting the signal, so you keep eating. All right, there are some medications that are responsible for weight. We've got some prescriptions that we provide that can help you lose weight, and we have some medications that are prescribed that will actually put on pounds. Okay, check it out. Okay, so several years ago, when I was in my first practice after finishing residency, I had a patient who came in. She was distraught. She was, you know, I diagnosed her basically being anxiously depressed. Started her on a medication, first-line medication. We put her on, told her to take a few weeks to go into effect. You know, come back and see me in 4 weeks, you know, so a month. She came back, she was distraught, the other doctors not working, I was just, you know, this, that, and the other. She was fearing losing her job. Okay, we'll try this different class. Okay, we gotta wait a few weeks for it to go into effect. You know, I tried to encourage her to be patient with the process. She came back, she was not sleeping, it looked like she just rolled off the couch and came in. Her hair was back in a ponytail, her t-shirt was wrinkled, and she was wearing some sweats, and she just wasn't making eye contact, just crying. And so I said, okay, you know, so now I'm at a loss. I'm like, okay, well, we've got these samples, you know, this medicine's supposed to work right away. Okay, so take this, and we're not going to wait, you know, for a whole month. You got to come back and see me in just a few weeks. So she came back. I didn't recognize her. I didn't recognize her for some good things and some bad things. The good thing was that I didn't recognize her because she had on some nice clothes. She had her makeup done oh so nice. She had gotten her hair cut and dyed. And the only way I knew who she was, I'm thinking, is when she talked and recognized her voice. But she had also gained about 15, 20 pounds. And unfortunately, it was because of the medicine I put her on. Okay, so I'm thinking, well, we can't have this. We can't have this. We can't have this. You know, the risk for the health risk associated with obesity can roll you away. Now, granted, earlier on she couldn't eat. Her stomach was in knots. And so she wasn't eating, so she had lost weight. But she had regained her weight and some. Okay? And so, and I was telling her, trying to go into the health risk and what we need to change this medicine, and probably she stopped. She said, Doc, let me be fat. And I was like, it was hard for me, but you know, when we look at prescribing medications, we look at risk versus benefit. In her case, the last visit, she was thinking about being unalive, okay? And we contracted for safety and all that. She said she wasn't gonna do anything to her, you know. And again, risk versus benefit. Now, why am I telling you this story? I'm telling you this story because there are some medicines that we prescribe that are necessary. She got her life back. She did lose her job because she kept calling off, you know. She couldn't show up for work. She couldn't be present for her family. I mean, she got her life back through the miracle of medicine, but it did cause some problems, okay? And there are some other medicines that can cause weight gain, okay? You know, not only insulin and steroids and medicines that we use to treat neuropathy, you know, heart medications. I'm not going to put them on here because I do not want you to stop taking your medicine. Do not say I went to that seminar and it's that medicine that's making me this way and I'm going to stop it. No, ma'am, no, sir. You take your medicine and you have a conversation with your healthcare provider, okay? If you think there's a medicine that's interrupting your health, you have that conversation, okay? Can we contract for safety here? I mean, you know, because, you know, some medicines you stop taking, if you stop taking for your heart, that's it, okay? We want you to live long and strong, okay? But we want to also use wisdom. Can you say wisdom? Wisdom. All right, thank you. And there are some medicines that can aid in weight loss, okay? I'm not pushing medicine today, but there are several, you know, you've heard about the Ozempic and the Wegovy's and Rachael and Adipex and Contrave. There are some medicines that can help. You know, so do keep those in mind. All right, so our key considerations. I need you to know that weight management is multifactorial. Multiple things that play a role, okay, and managing weight. But what we can do to help ourselves is to eat healthy, whole foods, okay? Have regular physical activity, like walking and acid resistance training. Get adequate sleep, but not now, okay? And we want to take care of our gut, okay? When necessary, get medical guidance, okay? So, thank you. I know you want more, but that's all for now. And until next time, be in health.